Well, thank you, Chairman Pallone, Ranking Member Deal, and the members of the subcommittee. Thank you for convening this hearing and for inviting me to testify today about H.R. 995, the Mammogram and MRI Availability Act. I also want to thank the breast cancer advocacy groups for coming to testify about the work they do, the problems we face in the fight against breast cancer, and the ways in which they and their organizations are helping to educate, screen, treat, and care for women living with and at risk of developing breast cancer. We all know people near and dear to us who have battled breast cancer, my wife among them for the last 3 years. We all know the statistics. Breast cancer is the second leading cause of death of women in the United States, the leading cause of death of women aged 40 to 49. This year alone, more than 40,000 women in the U.S. will die from breast cancer, and more than 192,000 new cases will be discovered. We also know that in addition to the need to find a cure, prevention is the difference between life and death. The 2005 National Institute of Cancer study affirmed that mammograms contributed to a pronounced drop in the number of breast cancer deaths. Study after study has found that yearly mammograms, annual mammograms, done from age 40 on, help find tumors at their smallest and most treatable stage. That's why the American Cancer Society and others recommends that women age 40 and older should have yearly mammograms. And that's why I introduced H.R. 995, a bipartisan common sense bill to ensure coverage of annual mammograms for this population of women. While many insurance plans cover diagnostic mammograms, that is, mammograms used to diagnose whether an already known mass or tumor is cancerous, many insurance plans do not cover screening mammograms for the purpose of detecting tumors in the first place. Based on the research and on what we know about breast cancer, this is simply unacceptable, and women and their families deserve better. We would save many, many lives if all plans covered annual screening mammograms for women of age 40 and above. As we have learned, mammograms on their own do not detect every malignant tumor. For women at particularly high risk of breast cancer, women who have a strong family history of breast cancer, where a woman's mother, grandmother, sister, or daughter was diagnosed with breast cancer, or those women with the BRCA1 or 2 genes who have a genetic predisposition to developing the disease, MRIs help detect more tumors at their earliest, most treatable stages that mammograms cannot detect. For this population of women who are particularly susceptible and at high risk of developing breast cancer, the American Cancer Society recommends an annual mammogram and an annual MRI. As with coverage for mammograms, insurance companies do not routinely cover screening MRIs, even for this high-risk population of women. H.R. 995 would make these important screening exams available to the women who need them most. While women should consult, so in other words, what this bill would do is to say that any health insurance plan that provides for coverage for diagnostic mammograms must provide coverage for screening mammograms for women annually over 40, and for the high-risk population of women over 40 for MRIs annually as well. While women should consult a doctor before undergoing a mammography or MRI, nothing in this bill requires a woman to seek a doctor's referral prior to receiving one of these life-saving screening exams. Nor does the bill require a woman to undergo any test unless she chooses to do so. As the subcommittee well knows, Congress is on course to pass a historic health care reform bill this year. That legislation contains important prevention provisions that would eliminate co-pays and deductibles for recommended prevention services. These recommendations should include screening mammograms. However, neither House of Congress has passed the legislation. Furthermore, even if passed, delays upward of 5 years or more could continue to limit women's access to these exams. Therefore, passage of major health reform won't necessarily prevent these women from continuing to fall through the cracks. Additionally, the prevention measures likely to be included in the final health care reform package do not currently include coverage for MRIs for high-risk women. Thus, the women most at risk, the women with strong family histories of the presence of breast cancer, as well as those who are genetically predisposed to the disease, will continue to be left without access to these life-saving exams. Only passage of H.R. 995, either as a standalone bill or by inclusion of its provisions in the comprehensive bill that this committee is helping to shape now, will ensure that these women have the coverage they need and on which their lives may very well depend. Mr. Chairman, with the passage of this bill, or with its inclusion in the overall bill when that passes, women age 40 and older, as well as those women at particularly high risk of developing breast cancer, will no longer continue to fall through the cracks. With this legislation, these women will be guaranteed coverage for life-saving screening exams. As we wait to find a cure, ensuring coverage for screening mammograms for all women aged 40 or over, and where indicated, for the high-risk population of women over 40, for MRIs as well, could mean tremendous benefits for many, many women and their families in the fight against breast cancer. Mr. Chairman, I thank you again for giving me an opportunity to discuss this bill, H.R. 995, the Mammogram and MRI Availability Act, and for holding this important hearing on women's health. I look forward to working with you as well as my colleagues on the subcommittee to pass this legislation in one or the other form. Thank you very much.